Joining me now is Dr. John Trapp with Bryan Health. We want to answer some of your questions that you may have when it comes to COVID-19. Doctor, thanks for being here. We appreciate that. Let's go over, I guess, right away, the main symptoms of COVID-19.
Well, the symptoms of COVID-19 can range from fever, cough, chills, malaise, things that you might feel with a viral type syndrome, and they can progress over time to symptoms of shortness of breath, chest congestion in more severe cases.
And another key, fever?
Fever.
Yep. So how do I know if I have COVID-19 or just the regular flu?
Well, that's the real million-dollar question. How do you separate those two? Both are viral syndromes and present in very similar ways. Really, the best way that we've determined in the past is based on history, exposure, travel. As things have changed here in the last week or two, even that's become more difficult. So it's making a real challenge to make the right diagnosis. Typically right now we're excluding those diagnoses. So if we could exclude the other diagnoses, we're left with saying, you know, COVID-19 is the most possible diagnosis.
Well, that kind of takes us then, okay, I'm sitting at home, I think I have the symptoms, I didn't go to work, so, you know, I was a good person, good worker, employee. It's not getting any better. What do I do now?
Well, if the symptoms are mild and you have had exposure or there's concern for COVID-19, it's really isolation. It's to stay at home for the next 14 days, see how symptoms progress. Again, 80 to 85% of the patients, they get better all by themselves.
So how do I know when I need to be tested? When do I need to go through a drive-through that is being set up?
Yeah, if symptoms progress, you develop those symptoms of shortness of breath, chest congestion, that's when it's time to come in for evaluation. And then we screen for other types of viral syndromes, and then if it's appropriate, chest imaging, and then the next step is to test for COVID-19.
More questions from our viewers on Facebook. How does COVID-19 spread?
Well, the most common way is through aerosolized droplets from coughing. So those are within the nasal passageways. You cough, you expel those, and then it either touches objects that you may touch, or your hands, or inhaled by other people around you. One
of our viewers want to know, how long is it in the air versus how long is it on surfaces?
Well, that's a tough one to know. You know, most times when you cough, those droplets are fairly large. They'll drop to the ground relatively quickly. I don't know if I can give you an exact time. But boy, on surfaces, there's been some research out there saying they could be on surfaces for days. In some cases, metals and plastics for up to 3 days, but things like paper for a day. But I'll emphasize, that's not the most common way of transmission. Almost always it's transmitted through cough droplets.
And breathing it in. Okay. Will the upcoming warmer weather, we're in March now, will the upcoming warmer weather help in trying to diffuse this virus?
Unfortunately, I don't think that's likely to happen. Right now, the research would say that we don't know, but coronavirus happens year-round, and we do not see a seasonal component to coronavirus.
You know, if you get COVID-19, can you get it again? Are you immune to it?
Well, coronavirus is a virus that changes over time. So the virus that you catch today, you should develop antibodies and be safe for a period of time, but over time that will mutate again, and so you're susceptible to that, just like you can catch the common cold again and again.
Let's talk about the future. And we heard the governor talk about it, we heard the president talk about it, trying to limit the number of people that are in a group setting, making sure people are 6 feet away from each other. That's the world we live in right now, right? What advice can you give our viewers out there as we move forward? And each day it seems to change.
Well, these are tough times.
Yeah.
I mean, really drastic changes, and the whole intent of this is really to slow the spread. By slowing the spread allows the health system to accommodate those patients who may become ill. Bottom line, if you're sick, stay home, limit your contacts. If you're well, be cautious about who you gather with. The larger the group, if you're not familiar with who's in the group or who may be sick, you put yourself at risk.
Dr. Trapp, thank you so much. I'll
You bet.
shake your head. There you go.